Colorectal cancer is one of the most common cancers worldwide, often requiring surgery to remove tumors and prevent spread. Advances in medicine have led to minimally invasive techniques such as laparoscopic and robotic-assisted surgery, both offering smaller incisions, less pain, and quicker recovery compared to open surgery. However, these methods differ in technology, surgeon control, and their potential effects on healing. Comparing them helps patients and care teams choose the best option for safe treatment and smooth recovery. How robotic and laparoscopic surgeries differ in practice. Laparoscopic surgery, or keyhole surgery, uses small abdominal cuts, through which long instruments and a tiny camera are inserted. Surgeons stand next to the patient, operating in real time while viewing a flat-screen monitor. This technique reduces scarring and recovery time but requires skill, as the instruments have limited motion and rely heavily on hand strength. Robotic surgery expands these possibilities. Surgeons sit at a console, guiding robotic arms that hold instruments, and a 3D high-definition camera. Every hand movement is translated into precise, filtered motions inside the body, eliminating tremors and increasing accuracy. The robotic instruments bend and rotate beyond the limits of human wrists, offering superior flexibility in tight spaces such as the pelvis. Both approaches involve anesthesia, constant monitoring, and short hospital stays. While laparoscopic operating rooms use towers and handheld tools, robotic setups require more time and equipment. Despite these differences, both techniques aim to minimize trauma and speed healing. Patient recovery and post-operative differences. For most patients, both surgeries mean smaller wounds, less blood loss, and faster returns to daily life compared to open surgery. Robotic surgery often provides an advantage in reducing post-operative pain and protecting delicate nerves and vessels. Patients may require fewer pain medications and sometimes experience less swelling or bruising, supporting quicker mobility. Laparoscopic surgery also ensures strong outcomes, though patients may occasionally take longer to regain full bowel function after complex procedures. Hospital stays usually last 2 or 3 days for either method, with bowel activity returning during that time. Complication rates, such as bleeding, infection, or conversion to open surgery, remain low in experienced surgical teams. Success depends largely on surgeon skill and patient adherence to recovery instructions. Risks, results, and long-term outcomes for colorectal cancer patients. Both laparoscopic and robotic methods are proven safe and effective. Shared risks include infection, blood clots, bleeding, or organ injury, though serious complications are uncommon. In some cases, surgery may need to convert to open due to technical challenges, but this occurs at low rates. Robotic systems may reduce infection risk thanks to their precision and cleaner tissue handling. Cancer outcomes remain the key measure of success. Both methods aim to achieve clear margins, removing all cancerous tissue while preserving normal function. Evidence shows similar survival and recurrence rates between robotic and laparoscopic techniques. 5-year survival outcomes are comparable, provided surgery is performed by skilled teams. Robotic surgery may provide added benefits in complex rectal cases, where nerve preservation is critical for bladder and sexual function. Enhanced 3D imaging and flexible instruments allow surgeons to avoid unnecessary nerve damage, supporting long-term quality of life. Laparoscopic surgery, however, continues to deliver excellent results when performed by experienced specialists, proving reliable and cost-effective. Choosing the right approach. While robotic surgery offers sharper vision, steadier control, and more flexibility, it also comes with higher costs and longer setup times. Its advantages become most apparent in challenging cases, such as deep pelvic tumors or larger cancers in difficult positions. Laparoscopic surgery, widely available and trusted, remains highly effective and less resource-intensive. Both methods reduce pain, shorten hospital stays, and support excellent cancer outcomes. For patients, the choice should depend on tumor location, surgeon expertise, hospital resources, and personal preferences. By weighing these factors carefully, patients and care teams can select the approach that best balances safety, recovery, and long-term well-being. Ultimately, minimally invasive colorectal cancer surgery, whether laparoscopic or robotic, represents a major step forward in care. Each method offers strengths, and the decision should reflect the patient's unique medical needs and life priorities. Understanding these differences helps patients feel informed and confident as they move toward treatment and healing.